Welcome back to What Happens in Vegas. Today we have a very special guest. She is not only the head health coach at Vegas Clinic, but she has her own amazing health story of overcoming a lot of symptoms that a lot of you might have suffered from. And we got to work together and see the transition. And now she helps people every day with these similar situations. So Amy, thanks so much for being here. This is long overdue.
Thank you. I'm excited to be here.
Yeah, so what we really want to dive into and what people love hearing and what has, I've shared is like your story, like what got you here, what got you passionate about helping people in the functional medicine space.
Yeah, so I've always considered myself like a healthy person as an adult. Like I was in the gym industry, like fitness industry for like 7.5 years, was more on the operation side, and then eventually went on to the personal training side. Always was like very careful about what I ate, working out at least like 4 times a week. And then, even when you look back at photos of me at that time, I always seemed like to have a hard time like losing weight, even though like I was doing everything I thought I could do, looking puffy, having some digestion issues, like especially with like fats. I noticed back then, like if I ate avocado, I would be in pain, like basically in a fetal position, or if I ate nuts. But I guess back then I just never really thought about it, thought maybe it was a bit normal. And I would just be like, okay, I'm just going to stay away from, healthier or foods that are higher in fats. And then all of a sudden in like January 2018, as I was walking home from work, I started to notice that my right foot started to go numb. And it was like a really cold day, a lot of snow on the ground. So I was wearing like heavy winter boots. And I thought, oh, maybe I tied it too tight on the way home. So got home, took my boots off. It seemed to get a little better and I didn't really think anything about it. But then eventually within a few days, it traveled up to my knee on the right side and was basically numb, and then started to have like drop foot. So then I thought, oh, there's something wrong, with my lower back, discs, that kind of thing. So went to a doctor to get a referral to get an MRI. You know how long it takes to get MRI here in Ontario. So it took a while to wait for that. But while I was waiting, all of a sudden the numbness went into all up my right leg, all up into my left leg, started to get a little bit of back pain during that time, but then it started to go into my left arm, my right arm. And then within like 8 months, I had like over 30 symptoms. So it started with like nerve issues, but then it just like a plethora of things. Like it was just insane. Like a lot of digestive issues, like going to the bathroom at least 10 times a day. Right when I woke up, I'd have to run to the bathroom and it'd be like that all day. Fingers were twitching, shocks, like electric shocks all the time. Like if my husband came to like grab, hold my hand or kiss me, I would shock him. Every time I touched like a switch, I would shock. Waking up in the middle of the night, peeing like 5 times in the night, chugging water. So that's how I got into this. Saw a bunch of specialists and they couldn't figure out what was going on with me and basically told me I needed to, take anti-anxiety medications. I was making myself sick and then I need to start therapy. So my last stint in the ER, where I spent the whole night in there, as I was walking home, a mutual friend of ours, I was texting him and he's like, you need to message Steph right now. Like you need to talk to her about what's going on. And then that began my whole journey into functional medicine, like messaging you saying, okay, we can do these tests. I've been through this before. I can help you. And then it just went from there, like finding out eventually what was going on, going through your protocols, your support, and how many years later, I think back in 2020, I started working for you and we're here now, like 5 years later, almost working for you.
Yeah. And like your insights that you get from going through it, because all of our health coaches have been through pretty much the program now with us, right? Because you get so many insights that you can't really, like, even when you explain those symptoms, like they just sound terrifying. And then most people don't know what to tell you about them. And then you got told pretty much you're having anxiety because they can't find anything overt that makes sense to them, because a lot of time in medicine, they're looking for like gross anatomical changes, like something that is like, terrifying that you can cut out or that they know how to treat. But these things are happening like without that, like, it's almost like a textbook case of like one of the big things for you was mold and you were actually in severe mold at that time. And like, if you study mold at all, like the shocks, the nervous system stuff, like, it's not even like rocket science, but if no one's taught it, then it's impossible to like make sense of those symptoms because they are so profuse and they go around your body and then they change your immune system. So then it turns on like other symptom patterns, right? Yeah. So it's hard for people to understand symptoms when they travel all over the body and it's seemingly unrelated. But when you get down to the root cause, it's actually easy to explain to people. And it's not meant to be scary in functional medicine, which some people get scared. Oh my gosh, I have mold. It's like, well, you already had mold. So now we've at least identified it and it's something that we can get out of the body. And that's what we help people do. But in that time, like, what do you feel like helped you the most? Like, what are different things that move the needle? Because I think that's so say, in the end, what did we find out it was for you? So let's kind of get to that.
So with all the testing that we did, we figured out 3 mycotoxins showed up. And so what helped with that was like getting out of the, where I was being exposed to mold. So that was the first thing. But also, I did the Armin Labs test at that time too and found out that was positive for Lyme and then Bartonella and then a plethora of other things. So, dealing with that eventually too, but we mainly did a lot of like mold protocols at first. And what really moved the needle was, I would say, like infrared saunas were like a huge thing for me that really helped me during that time because I couldn't work out. I couldn't sweat, so I had to find another way. And I noticed with infrared saunas, I would feel like so good afterwards that eventually like we bought one for at home that really moved the needle. Binders are like my best friend. Like I think for the rest of my life, I will always be on them and switching through different ones. But that really moved the needle. At first, like I didn't really understand what binders were and why you had to take them. So at first, like I wasn't really taking them. So I'm like taking all these antimicrobials, but not taking anything really to mop it up and get rid of it. And then finally I clued in like, oh no, I need to be taking these on a regular basis. So that really helped. And then like a lot of drainage too. So like Tudka is like another amazing supplement that again, I don't feel like I'll ever stop taking. There's been some times where I've switched to other liver supports and then I always just go back to Tudka because I feel better on it too. What else moved the needle?
So you had to do a lot of manual stuff too, because because that helped me a lot. Like, I don't know how people get through this without the manual component. That's why we're always offering like our manual treatment or trying to find a directory and have people in different cities for other people, because getting good manual therapy to move stuff out of the fascia and like structurally move stuff around, I know helped both of us a lot, right?
Yeah, that really helped. Like I was seeing, Dr. Leah twice a week for a while and then once a week and then eventually it was once a month, but that really helped because I would feel instantly afterwards some good changes and then days later. Even like working on like nervous system stuff too on my own. So like meditation, I was really doing a lot of meditation during that time and that really helped. I actually did like CBT, so cognitive behavioral therapy, for about 6 months, and that really helped. It taught me when my symptoms were going crazy, what I could do to try to calm them down instead of getting into that cycle, right? Where I would start to like ruminate with those thoughts and then think like doom and gloom, like I have this and eventually I'm going to get that. So that really helped too. Because when I was able to keep, my cortisol down, then my symptoms wouldn't like go through the roof on me and end up in bed all day, wanting to cry. So eventually that really helped too. Learning tools that way. Yeah. But the manual stuff, it really, really helped. Yeah.
Yeah.
And I'm still a big proponent of that. I still see, Dr. Leah like once a month. And like, I know when I need to see her too. If I'm getting lazy with my own stuff at home, I always feel good afterwards.
Because you do the self-manual stuff too, which we're coming out with a course for that because of how much it's helped all of us get through symptom patterns that happen with all of these crazy chronic complex illnesses that we've all kind of dealt with. That are so common now. Like, so that's another thing. But yeah, so just going back to like what you said, we found mold. That was the first thing that we were kind of going after, but there's always more than one thing. And we see that with every single person that has any of these symptom patterns. And it's one thing that sets it off. We don't know what came first, the chicken or the egg, right? For you, I think you were in that mold and that just, your body was probably dealing with Lyme. We get exposed to these, they're called stealth infections, and our body's immune system keeps them at bay, but they give us small symptoms through our life, like, what you were talking about. But then there's like this tipping point, like this kind of perfect storm that happens. And for me, it was mold. And for you, it was mold as well. And then mine was reactivated by like literally COVID and COVID kind of shedding stuff. And like, I think that's why it's turned on for a lot of people, even in the last few years. So, and not only that, in the last few years, like if mold is one of the things that is a trigger for a lot of people because it dysregulates your immune system and slows down your liver. And then we also had 5G come out in the last 5 years where that makes mold make more mycotoxins, right? So,
Yeah.
just to make sense of people why maybe they were all fine and in the last 5 years it's become more of an issue because we've seen it with young healthy NHL players and even other sports, and like these are typically like the where people think are the most healthy people, so this could happen to anyone, and we're trying to get people to prevent this and be ahead of the curve where you don't have to go through what you and I went through in
Yeah.
order to get through these kind of terrible symptoms. So like if you didn't know, or people that just all of a sudden get these symptoms, like what would be like your first thing that you tell them? Like you already said, binders, like that's one of our first things that people, we want you to start, we think everyone should be on them, but let's talk about binders for a little bit and like what they do and why we love them so much.
Yeah, like it's just that any time that you're wanting to go through a program to get rid of something in the body that shouldn't be there, any of those bugs or mold, like they are creating these toxins that are being released in your body. So if you are you find out you have mold issue, or you start taking some things for that. Binders are just like so important because during that time that you are lowering or killing whatever, it's releasing even more toxins at that time that makes your symptoms even worse. So you go through like Herxheimer reactions, or what they call like die-off symptoms. And binders are imperative for that they help lower that, to help avoid that Herxheimer reaction, to the point that like you can't function at all. So that was like a hard lesson for me. Like I was not taking them. I didn't really fully understand them at the time. But eventually when I really through my own research too, to be like, okay, what are these? What does this do? I was like, oh my gosh, why am I not taking these? And then like that was a huge thing too. So yeah, they're so important. Like you can't take anything to get rid of something without being on a binder. It just like, you're not going to feel well at all. You're not going to move
Yeah.
that needle to get better.
Yeah, and then you can even make your symptoms worse.
Oh
And
yeah.
then we've had people even herx just sometimes starting with a gentle binder, and then we know if someone's like super toxic because even like that little bit of help that you gave to the body. So we use a bunch of different binders. So we love humic and fulvic, and those are like so broad spectrum, and depending on the shape of the humic and fulvic, they can absorb a plethora of different things. So they act like a sponge. They're like going into the body and just like attaching on to toxic elements without really depleting our own. So we love humic and fulvics, and we use different ones from different companies. Now we're diving into like the whole other binder world, like modified citrus pectin, which is like a beautiful one that has all of these positive effects on the body and bind up different things. We use chlorella. There's medical binders that people use in IVs to chelate heavy metals. And I think like these are becoming more and more necessary because of all of the toxicities that we're surrounded by.
Yeah.
So
Yeah.
we're almost at the fact where I don't care if you have any chronic illness or not, like start playing around with some binders, like, even for allergies. Like,
Yeah.
what's our favorite one for allergies?
Toxiprevent.
Yeah, like and we want to make them more available. So we have them on our store for people because we're sourcing stuff from all over.
Yeah. The one that I found that made the biggest change for me was carboxy. So when that first came out, I switched to that one, and I noticed a huge difference. Like before then, I still wasn't really able to work out. With working out, you can create some waste, and that would make me feel not the greatest. But with carboxy, when I introduced that, then all of a sudden I was able to handle workouts again, and be able to do more intense workouts and be fine. So yeah, I took that one for quite a while going through some things, but it definitely moved the needle, the carboxy.
What's your favorite binder right now at the moment? Because like even for myself, there at different points in time, different binders have helped. Carboxy was huge, and then I really loved the Toxiprevent. What's your favorite right now?
So the two that I always have right now is Toxiprevent and then Humic and Fulvic by Mother Earth Labs. So those are my two favorites right now. Those are the ones that like speak to me that I should be taking. I would say I take more of the Humic and Fulvic than Toxiprevent. Toxiprevent is usually like, for example, if my seasonal allergies seem to be ramping up, that kind of thing. But yeah, I would say Humic and Fulvic is like my number one right now.
And you said even like, you would always look back and you'd be puffy. So like all of that
Yeah.
kind of regulated after you detoxed yourself, right?
Yeah, even like my when my eyes seemed puffy too, and I remember going to the eye doctor once, like when I was in my early 20s, and saying that, and they were like, "Well, your eye's fine. We're not seeing anything ourselves," but they're like, "It could be liver issues." Like that's what the eye doctor said to me at the time, and I
Oh,
didn't
wow.
really, yeah, and I really didn't do anything about it. I was just like, "Oh, okay, that's weird." And now looking back, like I can really see it. It was just like all of a
Hmm.
sudden one day I woke up and I'm like, what is with my eye? And for a long
Hmm.
time it was a bit puffy.
Hmm.
And that didn't go away until I started doing like your program, like the protocols. All of a sudden one day I woke up and I'm like, oh wow, like my
Yeah.
eye looks completely different. And even like my parents, my mom right away was like, oh wow, that eye looks so much better. But for
Yeah.
years I had it and just like ignored it.
I mean, like even for me, because I had my issues, I got over them and then it got turned on again and like my face changed and I puffed out right away. Like it's insane. And like I wasn't even gaining weight. It was all like lymphatics. And then once I cleared them, I could be like 10 pounds different, like from one day to the next if I got like proper manual drainage, did really well
Yeah.
on my supplements, like, and got a good sleep. So like I think that obviously like vanity and how we look, it's part of our health, right? It's not just like being vain. Like when these things are changing, like we should take note of them. They mean something. Like, even, we know lines in between your
Yeah.
eyebrows can mean liver stagnation, and 100% that's what I have and that's one of my issues, right?
Yeah. Yep.
Or yeah, like
And
wrinkles
hair.
around the mouth and like your
Yeah.
large intestine. Like so we have to start to like when did we lose like these cues that the body like for sure in the past like we lost this knowledge. Like people were making observations, observational medicine, anecdotal evidence was medicine, right? And then we lost that. So like the fact that that doctor saw that and noticed it, like there should be more of that. Like that should be
I
medicine.
know,
No?
I know. And then I should have listened. Like, there was a sign right there, like the outside is showing you what's going, giving you clues of what's going on inside. And my early 20s,
Yeah, but what
I
did you
wasn't
didn't
thinking
know
that.
what to do about it?
No, he's just
Like,
like, oh, like it could
yeah.
be, it's a sign of, liver. And I was like, okay. And then during that time, I don't even think I had a family doctor when I first moved to Toronto. So I just like was like, okay, I didn't think about going to get blood work, inquiring about it, nothing at that time.
Yeah, but I don't think they would have done it at that time.
Oh,
If you
probably
think about
not.
it,
No.
like because it's not, it would just be like brushed off as normal. But what are some other symptoms? Because you said, okay, so it started off with numbness in your leg, but
Mhm.
then it spread the numbness, and then you said you had like 30 different symptoms. I know
Oh,
it's hard
yeah.
to remember all of them, but let's try to go through some and then explain to people like the basis, like why that happened. So let's try and do that.
Well, the electric shocks,
Hmm.
the electric shocks was huge. And
Hmm.
that was definitely because of a mold. And you can explain better than I can about like what mold does for that.
Yeah.
And the thirst too. So that was a clear
Oh,
sign.
yeah.
Yeah.
Those go together.
And then, and like urinating a lot, like peeing in the middle of the night,
Uh-huh.
several times. And then like I would get up and have to pee and then chug a glass of water right afterwards, like several
Yeah.
times at night.
Yeah, but it's really good that you did that, chugged it after, because I wasn't doing that. And then that makes the symptoms worse. And I'll explain that. So these all go together. So this is great. We've got the thirst, we've got like the frequent urination and the static shocks, right?
Mhm.
So those all go together. Did you have any like tingling with that too? Oh, you had the twitching because that
Oh
goes
yeah, I
together
had
too.
the finger twitching, the nerve pain. So it would
Uh-huh.
be widespread to the point that I would have to be in bed, like widespread nerve pain. And it wasn't just in my limbs, it eventually went into the right side of my face, if you remember. And then I
Yeah.
started to get tingling on my chest and then my abdomen and then like on my back as well too. That
Mhm.
eventually happened after the
Yeah.
limbs.
So we'll start with that. So when you have mold affects like our hormone like ADH, right? So that's our diuretic hormone. It kind of like shuts it off. So you're peeing out more, but you're losing more minerals. And then the changes in your minerals in your body, it changes even the amount of salt on your skin because your body's trying to balance. And then that extra salt on your skin makes you so much more conductive. So you touch metal, you touch someone else, and you get this like electrical shock with it. And then also when you start to change your minerals like that, obviously everything in our body works on the nervous system, on nerves, right? And
Mhm.
they use it's the difference of crossing of different minerals across barriers that make our heart beat and all that. So it changes this mineral balance, and then we can get those painful twitches. But you also have more waste that's accumulating too. So
Mhm.
that adds to the twitching. There's more lactic acid. And then like obviously the thirst comes from the same reason that we're getting the urination, because you've peed out way too much, way too many times, more than you should. And also people can get like this like buzzing in their whole body when that happens too. So at night you could just be buzzing, and then it stresses your liver. So there's this whole like connection to that. But that mold is like very well known for those like that frequent
Mhm.
urination leading to the static shocks. And it ties into something called melanocyte stimulating hormone, but we won't go there. But that goes down. And then there's just a whole bunch of changes that happen with that, including changes in people's skin, like, right?
Oh,
So,
yeah. So that was a huge thing for me too. My skin is definitely like thinned out. I remember like
mhm,
during that time I was getting like IVs, you know, like Myers cocktails and stuff. And even the naturopath I've seen at that time, he's like, "Oh, your skin's like getting thin." Like he could
mhm,
feel it. That definitely happened, and it's still a thing I'm working on.
yeah. Discoloration too, though, like pigmentation and stuff like that can
Mhm.
happen, and that can be stagnant lymph that's in that. It was a big one for me. Also, your ferritin goes up way high, and if,
Yeah.
yeah,
I was going
so
for
that
blood
can,
work weekly, remember? And it was just going through every week. It was higher and higher, the ferritin, which brings back to the another supplement that really helped move the needle. That is the turmeric BCN 95,
yeah.
and then more liver support for that.
Yeah, that helped me too. Actually, I just retested my ferritin, and for the first time it's like in the hundreds, and I've been doing the BCM with the milk thistle. So yeah, you can like chelate it and help your, your skin, and I'm reacting less to the sun, like, and I'm in the sun right now
Yeah.
for those like dark spots and stuff, but I have so much to get rid of that I never had. Like I have pictures of my chest from before this happened, and if you think about it, all the lymph stagnates around your chest because it has to clear it, into the termini, right? That's where your lymphatics clear, is
Mhm.
all under your collarbone. So when it overflows, like I tell people, it goes to your vagus nerve, and that can create a lot of the anxiety symptoms, which I know you had and I
Yeah.
had myself. But it also spills over. So people can get like a full arm feeling. Like I got that a lot, like swollen arms, pain, like kind of in your biceps, pain kind of right here in your chest because
Mhm.
like things can't drain. And then it puffed out my chest without me knowing of it. And all these toxins were sitting there and they were trying to escape through the skin, including like the ferritin. So I have so much dark spots on my chest and I had none. I have pictures from like literally 6 months before and I did not have one. And now it's like covered. So I didn't realize that at the time.
Yeah. For me, I would say it's more like I have one dark spot on my face that popped up like in things like 2019. All of a sudden, one day I noticed it.
Where
Not
was it? On your here?
under my left eye, like right along
Yeah,
here.
so yeah, it's common like here under the left eye. This right side is big time like liver gallbladder spot when it's really
Mhm.
stagnated. And then here I think is spleen, but it can be liver as well. But yeah, you'll notice those people get that. And then like you said, like you can get like more of the bagging under the eyes and people
Mhm.
start to get eye symptoms from not clearing their face. Okay, so that's good. We went over the twitching, the static shocks, nerve pain. Obviously, like when your minerals are off and there's so much waste in your body, like your peripheral nerves don't, and blood flow is a huge problem.
Oh,
Whenever there's lymph,
yes.
yeah, right?
Yeah.
So more pain when you're not getting enough oxygen to tissues. So anything that we can do to get better oxygen, and something I think that I know helped me, I'm not sure if it helped you as well, is that nitric oxide builders for
Mhm.
me was
Yeah.
huge.
Yeah.
Yeah.
I was still dealing with like blue, like my feet would turn blue very easily. So if I
Yeah.
sit for a certain period of time, I would look down and my feet would be blue, like blue.
Hmm. Hmm.
But nitric oxide definitely helped with that. That definitely eventually went away. But that was
Hmm.
one of the things that like lingered for quite a while. It just wouldn't go away, but I know helped for sure.
Yeah. And then other things to like thin the blood, break down like fibro, like you did systemic enzymes at some
Yeah,
point,
I
right?
did. Yes, I did. And it was nanokinase I did.
You did nanokinase.
Yeah,
I
I
did
didn't do
Baluchi.
Baluchi.
Yeah, yeah. So these like systemic enzymes, like because we get a lot of waste and then you get like a thickening of everything, right? So we're just trying to thin out the blood. So, even, and this is not something that I'm suggesting people do, but when people have a lot of symptoms and then they start like have a drink of alcohol and they're like, oh, I felt better for that moment, and then you feel worse. But your blood temporarily thins with alcohol, right? Before then it stagnates. So that's like a sign, you need to get better blood flow places. And a lot of problems too is there's a lot of dysregulation that happens with our calcium channels. So that's part of what happens to turn on a lot of the symptoms. And we get leaking out of our cells because we're getting this influx of way too much calcium into the cells. It's damaging the membrane, and then calcium's leaking out, and our body has to do something with it because calcium can kill us. But it's not always going back into the bone if you don't have enough K2. So K2 is a big one too. And then also, it starts to calcify different parts of your body that you don't want calcified. It forms stones in the kidney, can start forming stones in the gallbladder, can go into soft tissue and cause pain. Calcium will join with oxalates because it's just trying to neutralize stuff. So there's this like calcification that's happening to people as well. And then the nitric oxide helps that, but so does things like we use stuff like GABA, anything to regulate calcium, right? So those move the needle a lot for me, the GABAergic stuff. So either taking GABA or having GABA tone helped even with that severe anxiety, because sometimes that's a rush of the calcium coming out. Yeah. Okay. So what else? Did you have any organ pain? Because I had severe liver pain, kidney pain, where I felt like I had to punch my back, and like people can mess up the kidney pain for like musculoskeletal pain. And then the liver pain is usually like right under the rib, but it can just go to the right shoulder and the right neck. Yeah. Did you have any of that kind of pain?
So definitely liver pain, and then kidney pain would happen every once in a while too. And I definitely had like the right shoulder, right neck, like it would just feel extremely tight all the time because of that. I always felt like I felt like something was pushing on my stomach too. Like I barely had an appetite. Which is like, I lost like 30 pounds during that time. Like obviously like I was having diarrhea several times a day, but I was having no appetite. Like I felt like my spleen was like pushing on my stomach. Like I felt like I had no room in my stomach at all.
Okay.
Anything.
This is,
Not an organ, but like I remember when the doctors I think it was my last time in Emerge where I spent overnight. Like I had the heart palps, and then like they said like I had costochondritis because I was having really bad like rib pain on the left side too.
Yeah. So, I mean, costochondritis is like a textbook question for either Lyme, Babesia, Bartonella, right? Like it can create that. They like the joints there. They can also inflame like the heart lining, and people don't realize that. And then when the lymph can't drain out from around your heart and your heart's so electric, if there's any of that structural pressure, you're getting palps, like it's palping back at you, and nobody's like explaining that to anyone. Because if you do work now under your collarbones and stretch and do some of the pec stretches and stuff, the red light helped me a ton, flex beam, then that helps those symptoms. But those heart symptoms, once you've ruled out obviously any major actual heart things, I mean, those are like that congestion that happens around the heart, and the way that these stealth infections and mold can affect the heart. It's a nerve as well. It's one of the most innervated parts of our body. So it's hugely affected, and we found ways to help people troubleshoot them, get out of symptoms, and also not be able to turn on all of these different organs that get turned on and infected by just like actually like getting you straight on a binder, knowing that we got to kill something acutely for people that we get now acutely with our symptoms, right? Like we can help them kind of get out of it, and they don't have years of suffering like we did. So if you can do something preventative, like, I don't know, we do all these tests on healthy people, and we find a whole bunch of stuff going on that we can clear out, and then they prevent going through what we went through.
Yeah. Another big thing. Sorry, go ahead.
No, tell me, and then I'll go back to those organ referrals.
Another big thing for me too was I was having histamine issues, but not realizing at the time. So it would be always at night when the sun would go down, I would get extremely itchy, like itchy everywhere. And I would never see a rash though. So, but it would just always, when the sun went down, all of a sudden, it would just be like, I would have to scratch my head, my ribs, like I just couldn't stop. And it would last like all night. So that was a huge thing at nighttime that I dealt with too.
Yeah, that is definitely something that I dealt with. I actually saw the rashes though, and like obviously huge like liver sign, because like when the histamine excess, and then for women too, they might be more itchy at the higher estrogen parts of their cycle. So when you're in that follicular phase, from the day you get your period to when you ovulate, that's when estrogen's highest. And then some people have estrogen dominance, so it's high like the whole time. That's going to make that even worse. And then plus, because because of a lot of the urination, excess urination happens at night, that adds into the itchiness too, because again, we don't have enough water to balance all of the minerals and we get more electric. So it can
Yeah.
be a combination. But the histamine thing is huge. And again, like, you know, everyone's like MCAS, histamine intolerance, POTS, this and that.
Yeah.
All of these things tie together. So let me just say something important, because this is something I know you dealt with and I dealt with as well. Like, this affects your collagen, right? So, right? Even
Yeah.
histamine affects your collagen, but people's collagen gets temporarily weaker in some areas. You get tighter in some areas. And then that can turn on all these symptoms, because POTS can be like, now all of a sudden there's slightly more pressure from your brain going down because it's not being held up by your fascia.
Yeah.
And you're getting these crazy vascular symptoms because you've gotten pressure, physical structural pressure again, because like some of these symptoms can go away when you lay down, because now you're not getting the pressure of the weight of your head. So all of these things get together. But if you fix the histamine, if you take out the stealth infections, if you support that liver, the collagen starts to get stronger again. Our body's so smart, right? And like, if you get away from the infections that are actually like breaking down our collagen, like Lyme and all the other collagen loving, you know, infections, stealth infections, I mean, then you start to get better and you start all of these funny symptoms, because collagen's everywhere. So I have pain in my ankle, and then all of a sudden I have shooting here, and then I have pain here, and people can't put that together, but that's part of the reason. And when you get a gush of histamine, you get even temporarily more weakening and more inflammation. So you could have these crazy diffuse symptoms.
And I was injuring myself very easily during that time too, without even like, I wasn't working out. Like I couldn't, I was not capable of working out. And I just remember like carrying groceries home, and I overstretched my elbow from, you know, just that, which would never have happened before. Find myself being a lot more clumsier during that time too. Yeah, it was just like collagen. I knew like something was wrong with collagen and all of that too. My joints, it was just, anything would like injure me easily. And, you know, my neck was a big issue too.
Yeah. And everyone talks about Ehlers-Danlos, like EDS. It's not Ehlers-Danlos.
Yeah.
You do not have like a dysfunction that's genetic. You have something turned on, toxic, environmental. So I know it's just like words, but it bothers me, like everything being called POTS. Well, is it POTS when you're still lying down and you have dizziness? Because POTS is supposed to be like you're dizzy from sitting to stand. No, it's autonomic dysfunction, and it's coming from like a toxic overload. So like, you know, everything gets lost in there, and it ends up getting more confusing. But what we really need is like to support the collagen as much as we can with like amino acids and different minerals and, you know, different, like support the liver and all of that, like bind up the toxins and get rid of them, and then work on actually like getting rid of those root causes while doing the manual stuff to help you get over the symptoms that are going to inevitably pop up. Yeah. So I just want to go back for people that don't realize, like shoulder and neck pain that's like chronic and it's always on the right side, that can be a sign that you have a problem with your liver. And sometimes a simple liver detox, maybe if Amy and I, before our symptoms turned on, were told about a simple liver detox, nothing of this would have happened. And we, you know, but the whole, also I wanted to talk about the pushing on the stomach. That like, because like, again, when our vagus nerve goes off because we have all this toxicity and it's not active because we're always in this cortisol state and in this stress response, like we do not have our migrating motor complex happening. Like stuff's not going down, it's just staying stagnant. We're not getting that good release of like liver bile. We're getting like stagnation, and that shows up as all the organs, they physically get pushed upwards. And like that, just like my last thing that I'm going through with my current situation is I had this severe like hiatal hernia because I didn't realize stuff was getting pushed so far up that part of my stomach herniated above my diaphragm. And that was from, even for me, like I had this stuck lymph, and your lymph has to all clear through something called your cisterna chyli right behind that stomach. And we have so much lymph dysfunction when this is going on. That's part of the thing that pushes it forward. Then we have our nervous systems turned off, so stuff's not going down properly. And we have all these little changes that like just show up as like feeling like we can't eat. But meanwhile, it can be turned into something much more serious. Like unfortunately it did for me, and it has for multiple other people. So, and again, histamine does that too. It pushes everything back up. It makes like too much unhealthy bile, and the bile or stomach acid and the acid can come up and burn the areas and don't even feel it because they don't have introspection of their actual organs, which I think you and I, we feel our
Yeah.
actual organs.
Yeah.
Yeah, the heart palps,
Oh
the
yes, it's like
costochondritis.
anytime you do, like even with you too, like we always try new practitioners out too, right? Just to see and what they do, how they help people. And everyone that I've ever met, they're always like, "Oh, you really know your body," and I'm just like, yeah, like I've been through a lot. Like I feel everything. And I feel like when you go through stuff that we've gone through, you become very introspective. Like you just know exactly what's going on or where it's coming from. Yeah.
Yeah, it's, and like I feel like a lot of people don't at all. Even like a, chronic little cough can be like silent reflux and people don't realize that. Or always like having to clear your throat or
Yeah.
having like phlegm in the morning, like those
Yeah.
type of things. But maybe if we actually learned about them, people would be more introspective. Okay, so we've talked about a ton of symptoms. What are some other ones that you can remember? Mine, I got a lot of swelling. Did you ever get like your limbs swelled up, or like even just the feeling that they were swollen, or that wasn't one for you?
Yeah, it's mainly my legs. It was never really in my arms. It was definitely my
Hmm.
legs. I do have like lymphatic issues. Yeah, puffiness there around the ankles, but not so much in
Hmm.
the upper limbs.
Yeah, yeah. Mine was my limbs, and like, I mean, I had this gigantic left breast, which was very interesting. Like,
Yeah.
my body just shows really kind of crazy symptoms. One thing that I had that I feel like a lot of even the players, like, it was like a lot of TL junction pain because the lymph couldn't clear from the back. And then, like, I feel like that's part of the thing that makes you feel more vulnerable, even like when you were, like you said, trying to just walk home with your groceries, right? Because there's like this
Yeah.
disconnect that happens with like the upper body and the lower body. This is what I've seen through all of this. And when you can kind of clear that, like even temporarily, people feel like they can do a lot more. And then if it tightens back up or fills back up, then, and it's that kind of like where your ribs end and your low back begins. It's all in that area
Yeah.
that,
Yep.
yeah.
Yeah. Yeah. I do notice like lower back can be a bit boggy too. Like it
Yeah.
does
So
swell there. Yeah.
Yeah, so that's like sacral edema. And I had a lot of SI joint pain, like all these pains that I
Yes.
never had before.
Yeah.
Did you have any sore like teeth or anything? Yeah, you got teeth symptoms, right?
Yeah, yeah, definitely had teeth symptoms. One tooth in particular on the bottom right,
Hmm.
the main one you chew with, basically, started to have issues with that. And then during COVID, when everything was shut down, you couldn't like go to your dentist or anything.
Yeah.
I started to have really bad issues with it, so I had like an emergency surgery to have it removed because they're like
Hmm.
either you need to wait for things to open up and do a root canal, which I was like, I'm not doing that. That's the last thing I'm going to do. Or, we're allowed during this time to do surgery to remove the tooth. So that's what I did. So yeah, definitely tooth symptoms or teeth symptoms I was having.
Hmm.
And then like, my story with that, eventually got an implant. Didn't go so well with the implant. And then this past Christmas, basically
Hmm.
like 2 days after Christmas, I had to have that implant removed because for a year I
Yeah.
started to have issues with it.
Yeah.
It's like my
And
body was rejecting it.
but yours was a metal implant, right?
Yeah.
So I've been waiting to do a ceramic full implant because I had this root canal and it's actually the same tooth, I believe, that we have problems with. And it's just been such a process of me going, and then I was right about to do it. And then that's when I had my esophageal burn. So I don't know. We'll see where that goes because right now I'm planning on getting it done in Germany, but
Yeah. And I need
I've
to
got
figure out
it.
what I'm going to do next. I don't know.
Hmm.
I don't know what I
Hmm.
want to do. I'm just letting
Yeah,
it.
so teeth are a huge deal, and there's actually like a Biohack Yourself coming out. It's a documentary on all the biological dentists, like really explaining the importance of teeth. But if you do have root canals, that's considered like a low grade infection, and it kind of it takes away from your vibrancy and your overall health. So that whole above collar infection thing, and I had two, right? So this turned on a lot of stuff. I had a root canal. I also had dry socket in my wisdom teeth. A lot of people get their wisdom teeth out and then you can end up with cavitations. That's considered an above collar infection, and that gives infection direct access to your brain. And if your brain's inflamed, then you have a
Yeah.
bigger chance of everything. I had Marcons, which is
Mm-hmm.
from the mold, which is
Yep.
a chronic infection in your nose, and people can have infections in their thyroid and they don't even realize, or just like toxic load. If you're not like draining down there, that's anything that affects up the collar can change your whole body. And you and I have felt it. So we talk a lot about, getting people to clean out their nose, and something that helped for me that I've talked about before are the LDIs.
Yes.
Did they do a big change for you?
Yeah, they did because remember, so after I had COVID, remember,
Mm-hmm.
so when I was really sick, I was having tinnitus issues, and
Mm-hmm.
after getting COVID, it came back, and like brain fog as well. And
Mm-hmm.
my very first LDI that I took for the like environmental, my
Mm-hmm.
tinnitus went away within like 2 days. It
Yeah.
was really bad the next day, like it flared up.
Yeah.
And
Yeah.
then after that, it went away, and I haven't had an issue since with
Yeah.
that LDI.
So you guys can go back and watch the LDI talk that I did with Dr. Nick Babelis. He's the one that introduced us to that therapy. Like, it's one of those things I'd heard about, but it's like almost seemed like I'm like, what do you mean you take a low dose of all of these toxins and it helps you? And it's the whole basis of
Yeah.
homeopathy. And I was like, this is crazy.
Yeah.
And I mean, for me, I did how many therapies on my nose to try to get rid of mark-ons, intense nose sprays, all these rinses, rinsing it with Biocide and rinsing it with binders. They all helped a tiny bit, but it just was staying there. I was out of mold. I was, trying to stay away from EMF as much as I could. But I hit that LDI number, which is low dose immunotherapy, or LDA, which is the low dose, like almost allergen.
Yeah.
So the ENV is considered one of those. And it's just a very low dose of literally molds, toxins that you get exposed to, pollens, stuff like that, and environmental exposures. And it literally shut it off like that. And then it turns back on, and then you shut it back off with it until it turns off completely. So listen to that episode if you want to know more about those, but you can use them for infections as well.
Yeah.
And you can use them, you can desensitize yourself if you have antibodies to hormones or antibodies to it's a whole other world. And
Yeah. Yeah.
Ty Vincent's the one that like has a course on it, but that's a whole other thing. But both of us had these amazing effects with that, and we've seen it with other people as well.
And the vertigo, I forgot to mention too. So it was the vertigo as well that got after COVID. So it was like the tinnitus and the
Amazing.
vertigo went away, and I haven't dealt with that since.
Yeah. And neural therapy both helped us because
Yeah.
of its effect that it has from moving toxins. So we talk about the lymphatic, it moves toxins, it resets your nervous system, even for moments. And in those moments, your body can like get some stuff done that it couldn't when you're in fight or flight. So, and different frequencies, right? Like, how much did FSM help you? It helped me a ton. And
It was for my spine. That's what mainly Dr. Nick would do with FSM for me. And it was amazing for my spine and my legs, like any of the lingering like nerve issues that was still going on.
yeah, and that's frequency specific microcurrent. And then there's other things that have frequencies that we use. Like, I use my infopathy all the time. Like, I unfortunately got shingles as part of a detox reaction, and it turned off the pain, like, immediately. So like, there's all these things that people don't realize can help them that are so simple. So that frequency specific microcurrent is just like these pads you put on it. You pick a frequency, because our frequencies go off when we're sick. Everything has like a vibration. We know that, right? Like, it's you can measure it. It's measurable. And when you're sick, that frequency goes off. Your aura is different, everything. So you're just kind of shocking it temporarily into like what it's supposed to be, again, to give the body that space for it to do what it needs to. And at the same time, we're always using different herbs and different things to eradicate these other pathogens and stuff from the body. So, it takes like a village to help you through these chronic symptoms, right? You've got to find what moves the needle for you. But the fact that it's often similar things that move the needle, like even Amy and I talking about and comparing our stories. Yeah. So other things other weird symptoms. Let's talk about a weird symptom in case this resonates with anyone. Cause I don't think you got this, Amy, but when I get the huge dent in my head, and it's like, it almost like as the cerebral spinal fluid gets pulled out of my body, I get a pain here, I get a headache here, I get a pain in my back. But you have had that dural symptoms. We all got those symptoms in the spine. The spine feels like all of a sudden it's a rock, like something feels wrong. And And the more I've researched it, I've found something called like spiky leaky syndrome. So it's like almost like it becomes too high of pressure in your cerebral spinal fluid. So it tries to find different ways to escape. And then it can turn on all these symptoms. But like I think that's what was happening to me in like this very real way. And it's a sign of like Bartonella can do this. But I got a full blown dent that will go in my head. It feels like my sutures like open. It's disgusting. And then hours later, I'll feel the pressure building and then it's gone. And it's almost like I have a slight cone head. And then I'd find out like, I have to work on my neck here. I have to work on my lymph. I have to work on my back, my spine, and do some stretches for my dura, and I can get it to go away. But for people are having like, when it doesn't come and go for them, they're just having these chronic, crazy headaches. Think about your cerebral spinal fluid, CSF. It's not being able to clear. And yours showed up as like severe, like spine pain and more like leg pain. But mine was like this really weird dent in my head.
And severe brain fog. Like I felt like I was like underwater all the time. And I wouldn't be able to concentrate. Like I just remember like I'd be sitting doing consultations with people and I don't even know how I got through those consultations. Like I couldn't hear them. It was like muffling and I couldn't read the computer. I was seeing double all the time. It was just like I was underwater all the time.
Yeah, I know that feeling. I felt like brain dead. Like sometimes if I'm having a bad day and my brain didn't drain, because when you sleep, that's when your brain clears. I swear I don't have a clear thought in my head for like a few hours. Like I just like, okay, well, today's one of those days that I'm going to have to just, do what I can. And then it comes back. But like, you can heal from that severe brain fog. You really can.
Yes. It was one of the first things to go away for me. I remember the brain fog was one of the first things to start to go away because I just remember being at work and being actually able to work and be able to concentrate. So that was the first thing.
This was a major thing. I mean, I had like heart block symptoms and I fainted a few times. So like those changes in pressure, like your body just going into shutdown mode, like you had the feeling of faintness, right?
Yes. Yeah. Low blood sugar. Yeah. Feeling faint, like shaky, like, those symptoms.
Very shaky. That shakiness is a big one for babesia where like it's just like you're almost like this like it doesn't have to be that like but babesia does that a lot. I had like the night sweats.
Oh yes, waking up just drenched. I forgot about that. Yes. Yeah, it would just wake up drenched the next day or in the middle of the night and just be
At my worst I was also coughing up like gray, like coughing up mold, and mold was coming out of my nose. So it had colonized. Like it is crazy to kind of think back on all those terrible, terrible things. So if people are going through any of this, like that's the reason that we're trying to like explain some of these symptoms and bring some things to light, because you might be going through this and you're like completely at a loss. And I'll tell you, the most stressful thing is not knowing what's going on in your body. Do you agree with that, Amy?
Oh, 100%. And then like, we're taught to go to our doctor, or different specialists, and it's awful to, when at the end of the day, you don't fit into their box for a certain thing. And then they're just like, you're creating this yourself. You're crazy. And you're just like, are you serious? Like, so many times I'd just be crying and like, after seeing another doctor or specialist and being like, I am not crazy. This is not who I am. Like I knew that. And thankfully, like I've always been a very strong-willed, stubborn person where if someone's like, don't do this, I'm going to do it. So thankfully for me, I was just like, I'm not going to listen to you. Like, I know this is not me. I'm not crazy. I'm not making myself sick. Like I'm upset because these have happened, right? That's why I'm crying and I'm sad.
I know.
So like when you hear that, like just don't listen. Find a functional medicine practitioner, come to us. We can help you. You're not crazy. You're not. No. There's a reason why you're feeling the way that you're feeling. There's always an answer.
Always a reason. Your body just doesn't turn on you like that. Like, let's just say that. Like that, there is a reason. And even like, I'll address something too, because I know a lot of practitioners are like, oh, it's trauma, like from your past. Like maybe that's part of it, but we're here to meet you where you are. Like your body, there is a time and a place to work on the deeper things. But when you're in an acute state, you have to work on the physical realm. Like what's going on in your body now that we can take out, give yourself a break, and then you can move up to the more spiritual types of healing and like these other things that people are talking about that are really powerful. And I'm talking about when people are talking about, oh, it's past trauma and that's why you're sick, or it's something like like that, like, you know, those are more that you can reach for those later after you get out of these more physical worldly symptoms that of the realm that we're actually in
Yeah.
without going too far.
And a lot of us, like we live in a culture that's all like hustle, hustle, right? Like you can't,
Hmm.
if you're sitting down trying to rest, it's like, oh no, I shouldn't be. What should I be doing? So we owe, a lot of us get that, feel that guilt and feel like we always have to be doing something. And like looking back in the past, like I was overworking. Like I was working very long hours. You did too.
Hmm.
And then your body starts to give you signs like, hey, we can't keep up with this.
Hmm.
You know, you are a perfectionist or whatever, and you ignore them, and eventually you get hit. And your
Hmm.
body's like, okay, you're not listening to me, here you go. And then you have
Yeah.
to start listening.
Yeah.
So a lot of times it's that too, that like a lot of us that do eventually not feel well with these kind of symptoms, like we are perfectionists, we are, you know, we overwork, we ignore the signs our body's giving us because we need to finish this by this deadline or whatever.
Hmm.
And like, you got to listen to your body. Like, you got to
Hmm.
rest. Yeah.
Yeah.
You have to
And like
listen.
we all got signs like way earlier, like in our 20s, that again, we didn't get the full memo of, right? Like
No.
and then you just push and you push and you push. And then there comes a time where there's just not enough reserve for you to just push through it. And then you're like forced to rest. So it's a good point. Like prioritizing self-care is more important now than anything. Like having boundaries for your entire life is going to protect your health and help you
Yeah.
heal as well. Because, you know, even social pressures to like have a drink, like you can't drink when you're going through these type of symptoms.
Oh,
Like
absolutely not.
it's
No.
I mean, your body will tell you, but the inability to handle alcohol is like a big symptom in itself. So if you have that already, stop drinking and start focusing on your liver because
Yeah.
yeah,
Yeah.
it'll only get worse.
Yeah. And then even like, like obviously like alcohol, but coffee. For a year, I had to completely cut out coffee because it would trigger a lot of my symptoms as well too. Like I couldn't handle it at all.
I couldn't I couldn't handle any other coffee but King coffee because they take out some of those stimulating acids and they add in reishi, but some people won't be able to handle that either. But luckily that actually helped me. Like I remember I did a test because like I love it so much, and then I cut it out for like 3 weeks and my heart palps only got worse, and I added it in and it actually helped a little bit because it that reishi.
Hmm.
So
Hmm.
yeah, but yeah, coffee can be overstimulating. And plus, if it's not a clean coffee, then there's like mold and toxins in it.
Yeah.
So
And back then
yeah,
I didn't know that, right? So I was just drinking whatever coffee.
yeah,
But yeah, Ken coffee is my favorite. It's still my number one. But
so good.
now, if every once in a while, if I am out and I have a coffee that's not so clean, I'm okay. But
Yeah,
for
me
about a
too.
year, I had to completely cut it out because it was just,
Yeah,
yeah, it was too much for my system.
yeah. Well, I feel like we could keep talking for hours, but unfortunately, we have like a hard stop. So, do you have anything closing that you want to say to people? Like anything at all? You've already given so much insight, but anything else that you would want to say to people?
Yeah, it's just like listen to your gut. Like you know if
Yeah.
something's wrong, you know, and a lot of us go through days and we're told that we're fine. There's something going on. Like you're at the end of the day, you know your body best. If you
Hmm.
feel something is up, there's definitely something up. And don't, you know, don't accept what they say. Like do your own research. Find
Hmm.
someone that will listen to you. Find
Hmm.
another practitioner or doctor. Because at the end of the day, like you know yourself. So don't
Hmm.
just give up.
Hmm.
Find the reason why you feel the way that you feel.
Yeah, I totally agree. We're always on the same page with that. Thank you so much for being here. This was long overdue. We'll do it again soon because I think this is like invaluable for people. I think this is the kind of stuff they want to hear, like what you did and what got it better. So thanks so much for being so open and sharing and spending your time with us.
Well, thank you for having me.